If you're over the age of 65, there's a good chance you're paying bills you don't actually have to pay. In fact, millions of older Americans are losing thousands of dollars every year without even realizing it, just because no one told them they had a choice. Medicare premiums, prescription drug costs, property taxes, and more. These aren't just numbers. These are the very expenses quietly draining your retirement savings, month after month, often for no good reason. You see, once you turn 65, there are legal benefits, exemptions, and protections that kick in. But here's the problem. They're not automatic. No one calls to let you know. You have to know where to look, or risk paying for something you no longer owe. This video is your wake-up call. I'm going to show you 6 common bills that seniors keep paying unnecessarily. Bills you might be paying right now. If you've ever run into any of these situations, or know of other hidden costs that older adults should watch out for, share your experience in the comments. You might help someone else avoid the same mistake. 1. Medicare Part A, Premium, Paying when you shouldn't. Most people assume Medicare becomes free once they turn 65, but that is not entirely true. Medicare is divided into multiple parts, and misunderstanding these parts can cost you thousands of dollars every year. One of the most common and costly mistakes seniors make involves Medicare Part A. Medicare Part A is the part of Medicare that covers inpatient hospital stays, skilled nursing facility care, hospice, and some home health services. If you or your spouse worked and paid Medicare taxes for at least 10 years, which equals 40 calendar quarters, you are eligible to receive Medicare Part A without paying a monthly premium. This is called Premium-Free Part A. Unfortunately, many people over the age of 65 are still paying up to $518 per month for this coverage, even though they qualify to receive it at no cost. That adds up to over $6,000 per year, paid unnecessarily. And this is not because they want extra coverage. It is because they were either misinformed, confused, or never told they had the right to receive Part A for free. Let me give you an example. Mary is 67 years old. She retired last year after working as a school secretary for over 30 years. Her husband was a postal worker, and both of them paid Medicare taxes throughout their entire careers. When Mary went to enroll in Medicare, she saw a list of different parts, A, B, D, and felt overwhelmed. A private insurance agent told her she should enroll in all parts to be fully protected, so she did. She began paying more than $500 per month for Part A, even though she already qualified to get it for free, based on her work history. Mary only discovered this mistake 2 years later, after spending more than $12,000 on unnecessary premiums. This is not just Mary's story. This is happening to thousands of people across the country every single day. The reasons are many. Some seniors are afraid of being underinsured and choose to pay for all Medicare parts just to be safe. Others rely on advice from private agents whose goal is to sell policies. And most importantly, there is no system in place that automatically tells you whether or not you qualify for free Part A. You have to ask. You have to check, and if you do not, the system will quietly let you overpay. Here is what you can do. Visit the Social Security Administration website at ssa.gov and review your work history. You can also call the Social Security office directly to ask whether you or your spouse qualify for Premium-Free Part A. If you are already enrolled and paying premiums, it is not too late. Call Medicare at 1-800-MEDICARE and ask them to verify your eligibility. It is easy to think that paying more gives you more coverage, but Medicare is not a cable package. Paying for something you already earned is not protection. It is waste. You paid into this system your whole working life. You deserve to get the benefits you are entitled to without being taken advantage of. 2. Prescription drug costs, the price you shouldn't be paying anymore. Starting in the year 2025, A major change in federal law means that no Medicare enrollee will have to pay more than $2,000 per year out of pocket for prescription medications. This change, part of the Inflation Reduction Act, is one of the most important updates to Medicare in recent history. But the truth is, most seniors are not aware of it. Right now, many older Americans are still spending $5,000, $6,000, even $7,000 per year on prescription drugs. And they are doing this either because they have not enrolled in Medicare Part D, because they do not understand the new cap coming into effect, or because they have never applied for Extra Help, the federal program that provides financial assistance for low-income seniors. Take Jim, for example. He is 72 years old and takes multiple medications for diabetes, high blood pressure, and arthritis. Despite using a pharmacy discount card, he still spends over $600 per month on prescriptions. That adds up to more than $7,000 per year, which is more than 1/3 of his total Social Security income. What Jim did not know is that starting January 1st, 2025, Medicare will limit his annual out-of-pocket drug spending to $2,000, no matter how many prescriptions he takes. Even more importantly, he may already qualify for Extra Help, which could reduce his copays to as low as $0 to $10 per prescription, depending on his income, but no one told him. He found this out only by attending a Medicare workshop at his local library. Until that day, he had been paying thousands more than he needed to. This is a serious problem, and it affects millions of older adults. Prescription drug costs are one of the top financial burdens for retirees. And when you are living on a fixed income, every dollar matters. But most people do not know that Extra Help exists, or that they are eligible for it. Even fewer know how to apply. The good news is you can take action right now. First, make sure you are enrolled in Medicare Part D if you take regular prescriptions. Second, check your eligibility for Extra Help by visiting the Social Security website or by calling your local Medicaid office. If you receive supplemental security income or are enrolled in Medicaid, you may automatically qualify. Otherwise, income and asset limits apply, but they are more generous than most people think. Finally, talk to your pharmacist or primary care provider. Ask if there are generic options or if your prescriptions are on the Medicare formulary. Many people continue to pay high costs simply because they assume they are stuck with a certain brand or supplier. It is heartbreaking to see seniors skip medication because they cannot afford it, especially when help is available. Do not wait until next year to act. Start preparing now so that when the new rules take effect, you are fully protected. What you do not know can cost you, but once you know your rights, you can start saving safely, legally, and confidently. 3. Property taxes, the homeowner's bill that shouldn't be so high. For many seniors, the home is more than just a house. It is the place where they raised their children, built memories, and planned to grow old with peace of mind. But while the mortgage may be paid off, there is still one expense that keeps knocking at the door year after year: property taxes. And what most people over 65 don't realize is that they may be paying far more than they legally have to. Across the United States, dozens of states and local counties offer special property tax exemptions, credits, or deferrals specifically for older adults. These programs can cut hundreds or even thousands of dollars off your annual tax bill. Some allow seniors to postpone payment until their home is sold. Others permanently reduce the taxable value of the property. But here's the problem. None of these benefits are automatic. You have to know they exist, and more importantly, you have to apply for them every year. Let's take a real-world example. Alan, a 74-year-old retiree in Texas, owns a small 3-bedroom house where he's lived for over 40 years. Every year, he pays about $3,800 in property taxes. He lives on Social Security and a small pension, so that bill puts a serious strain on his budget. One day, while speaking to a neighbor, he learned that Texas offers a senior homestead exemption that could reduce his tax bill by as much as 25%. He also learned that his county offers a deferral program that would allow him to delay paying property taxes until the home is sold without penalty. Alan had been eligible for both for nearly a decade, yet no one had ever told him. And because he never applied, he missed out on more than $20,000 in savings. Situations like Alan's are far too common. Many older homeowners simply pay their annual property tax bill because they think they have no choice, or they assume that applying for a tax break is too complicated. But that is not true. Most exemption programs only require a one-page application, proof of age, and sometimes income documentation. In many states, the income threshold is much higher than people expect. And if your home is your primary residence, you may already qualify regardless of your income. To find out what your options are, start by contacting your local tax assessor's office. Ask specifically about property tax exemptions, reductions, or deferral programs for seniors. You can also search online using the name of your state and the words Senior Property Tax Exemption. For example, type Florida Senior Property Tax Exemption, and you'll be directed to the state or county page with information and application forms. Do not wait for someone to inform you. These programs are often underused simply because people don't know they exist. A recent survey found that over 50% of eligible seniors had never applied for the property tax benefits they qualified for. If you have worked hard to own your home, you should not be punished for growing older. You should be protected, and that protection is already written into the law. You just need to claim it. 4. State income taxes. Are you missing out on age-based deductions? When tax season rolls around, most retirees assume their tax situation is simple. After all, they no longer earn a salary, and most of their income comes from Social Security or retirement accounts. But here's what often goes unnoticed. Many states offer special tax deductions, exemptions, or income exclusions for people over the age of 65. And unfortunately, thousands of seniors are missing out on them, simply because they don't know these age-based breaks exist. Depending on where you live, you may be eligible to subtract a large portion of your retirement income from your taxable income at the state level. In some states, you can even avoid paying state income tax on certain sources of retirement income altogether. But the system doesn't always make this easy to understand. In most cases, you have to manually enter or claim these deductions when filing your state return. If you rely on tax software or someone else to file for you, there's a real risk that these savings are being left on the table. Consider this example. Gloria, age 70, lives in Colorado. She receives Social Security, a small teacher's pension, and draws about $15,000 annually from her IRA. Under Colorado's tax law, individuals aged 65 and older can exclude up to $24,000 of retirement income from state taxation. But when Gloria filed her taxes using an online program, it didn't automatically apply the exclusion. Because she didn't check or know to look for it, she paid nearly $900 in state income taxes that she didn't actually owe. Now let's look at another case. Steve, who lives in South Carolina, receives about $14,000 in pension income. He qualifies for a full exemption under his state's senior tax laws, but he's been paying taxes on that income for years. Why? Because the accountant who files his taxes never flagged the exemption, and Steve never asked. No one ever told him he was eligible. These stories are common, and they show how easily seniors can lose money due to small oversights. Every state has different rules. Some states, like Pennsylvania, do not tax Social Security or retirement income at all. Others, like New York, allow significant deductions for pensions, IRAs, and annuities. But almost none of these benefits are automatically granted. They must be declared or claimed on your tax return. To avoid losing money year after year, you need to take a closer look at your state's Department of Revenue website. Look for terms like senior income exemption or retirement income deduction. If you're using tax software, Double-check the settings for age-based exclusions. If you work with a tax preparer, ask them directly. Have you applied all the available deductions for my age? Many retirees feel they don't have the energy or knowledge to challenge a system that's hard to understand. But this is not about fighting the system. It's about knowing the rules and using them to protect what you've earned. You paid your taxes for decades. Now the law gives you some relief. But that relief doesn't come unless you ask for it. And every year you miss it, you are paying more than you should. 5. Medicare Supplement and Advantage Plan Premiums. Why staying loyal could be costing you. Many seniors believe that once they pick a Medicare Advantage plan or a Medigap supplement plan at age 65, they are set for life. It feels safe, it's one less thing to worry about, and no one enjoys reading through piles of insurance brochures every year. But that decision to stick with what you have may be quietly costing you hundreds, even thousands of dollars every single year. Here's the truth. Medicare Advantage and Medigap plans change every year. Prices change, coverage changes, doctor networks change, and new plans with better benefits or lower costs become available, sometimes right in your zip code. But unless you actively compare and switch during the annual enrollment period, you'll never know. The annual Medicare open enrollment period runs from October 15th through December 7th. During this window, every Medicare recipient has the right to review their plan and switch to another if it offers better coverage or a lower premium. Yet research shows that more than 70% of seniors never shop around or compare plans again after their initial enrollment. Let's look at a real situation. Robert enrolled in a Medicare Advantage plan when he turned 65. At the time, it cost him $38 a month and included dental and vision. Over the years, the premium crept up slowly until it reached over $90 per month. The dental benefits were cut, and his preferred doctor left the network. But Robert never switched plans because he thought it was too complicated, and because no one ever told him that there were better options available. When he finally sat down with a Medicare counselor at 74, he discovered a $0 premium plan with nearly identical benefits. In just 1 year, he saved over $1,000. Another common mistake involves Medigap, also known as Medicare Supplement Insurance. Many seniors choose a Medigap Plan F or Plan G when they first enroll, believing it's the most comprehensive option, and it may be. But premiums for these plans vary widely by provider. One insurance company might charge $230 per month, while another charges $170 for the exact same coverage. Unless you compare every few years, you might be paying far more than necessary. So why don't more seniors switch? The reasons are understandable. The process seems confusing. There's fear of losing coverage or ending up with a worse plan. And there is a lot of conflicting information from private insurers who want to steer you towards specific products. But the truth is, switching can be simple, and the government provides tools to help. To take control of your options? Go to the official Medicare website at medicare.gov and use the Plan Compare tool. It lets you enter your medications, preferred doctors, and location to find the best plan for your situation. You can also call 1-800-MEDICARE or speak with a local SHIP counselor. SHIP stands for State Health Insurance Assistance Program, for free, unbiased guidance. The bottom line is this: staying loyal to your Medicare plan might feel safe, but it is not always smart. The system is built on the assumption that you will not check, and if you don't check, you pay more. The good news is, once a year, you have the power to change that. Take the time to review your plan. You worked too hard to let unnecessary premiums eat away at your retirement savings. 6. Utility bills and services. Senior discounts you're not being told about. When we think about bills that weigh heavily on our budget, we often focus on healthcare and housing. But there's another category of expenses that slowly chips away at a fixed income, and that's monthly utility bills. Electricity, water, trash service, internet, and phone bills may not seem huge individually, but together, they can easily add up to hundreds of dollars each month. What most older Americans don't know is that there are special discount programs available just for seniors, many of them offered by utility companies, state governments, and even federal agencies. But here's the catch: you have to ask. These programs are not automatically applied to your account. In fact, most companies will never mention them unless you inquire directly. Let's take Eleanor, for example. She's 78 and lives alone in a modest one-bedroom apartment. Every month, she pays over $160 just for electricity and heating, even though she barely uses her appliances. One day, her niece helped her review her bills and discovered that her energy company offered a senior discount program for customers over the age of 65. All Eleanor had to do was fill out a short form and provide proof of income. She now saves nearly $40 per month on her energy bill, almost $500 per year, just from that one call. And it's not just electric and gas companies. Many internet and phone providers also offer senior discounts or special plans for older adults. There are federal programs like Lifeline, which provides discounted phone or broadband service to eligible low-income households. There was also the Affordable Connectivity Program, which offered up to $30 per month for internet. Though that program ended early in 2024, still, many local providers continue to offer similar benefits through state-level funding. There's also LIHEAP, the Low-Income Home Energy Assistance Program, which helps low-income households, including many seniors, with heating and cooling costs. This is a federally funded program administered at the state level, and benefits vary by location. In colder states, the savings can be substantial, especially during winter months when energy use spikes. So how do you find out what's available in your area? Start by calling your electric, gas, water, and internet providers directly. Ask them, do you offer any senior discount programs or low-income assistance for customers over 65? Also, visit your state's Department of Aging website or call your local area agency on aging. These agencies often have lists of available discounts and can help you apply. You can also contact the National Council on Aging or visit benefitscheckup.org, which allows you to enter your zip code and find benefit programs you may be eligible for based on your age and income. The most frustrating part is this: the support exists, but it's quiet. It doesn't knock on your door. You have to look for it, and many seniors never do. They just keep paying full price, assuming that's the only option. But it's not. You have earned the right to ask for help. You have contributed to these systems through your taxes and your work. These programs were designed for people like you, and every dollar you save on utilities is a dollar you can use for medication, food, or simply peace of mind. Don't wait. Make the calls. Ask the questions. Because not asking could be costing you far more than you think. You've worked your whole life. You've paid into the system. Now it's time the system works for you. These 6 bills are quietly draining the savings of millions of seniors, not because the money has to be spent, but because the knowledge is missing. But today, you're no longer in the dark, so take action. Ask questions. Double-check what you're paying for. And if this video helped you, please share it, because someone you love might be paying for something they shouldn't. You've earned better. Now let's make sure you get it.